You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. With us, we have an expert on the topic, and he says, according to him, nobody should be wearing a loose-fitting denture. With us, we have Dr. McAnaney. Dr. McAnaney, welcome to the program.
I'm glad to be back. How are you doing, Randy?
Good, good. You say, and I know you brought photos and you brought some models, so we'll get to as many of those as we can. But first, for people that don't know your practice, who's your typical patient, and what are the different services you offer?
Well, my typical patient is everybody. Teachers, firefighters, policemen, college professors, students, you name it. We're in a kind of a rural area right on the border of Oklahoma and Texas, and so everybody comes. We do everything from teeth whitening, typical fillings, crowns, braces, all the things. So the patients I like the most are the people that their teeth are just deteriorated to a point that they're headed towards dentures. Back where we are, they call them plates, denture plate.
They call dentures plates?
I don't know what that means, but that's what they call them. Or a partial plate. That means that they have some teeth, but they have something clips on their teeth. None of that stuff works. Or people that just have dentures altogether. And so my passion is to help them realize there's answers to that, because none of that works, never did work, but with dental implants, we can make it work.
You don't like traditional dentures?
I don't like them.
Is that right?
You know what's interesting? You're asking me if I don't like them. I don't have any, so I don't know if I don't like them. I'm pretty sure I wouldn't like them.
Okay.
But here's what I know. Nobody that has them, no matter what they tell you, they don't like them. They might tell you they're okay with them, but they've adapted, but their life is misery.
Your feeling is that dentures, the way we know them today, will be gone someday. That means that dentures will all be attached to something, like dental implants.
You know what? I do believe that. I mean, who wants to? Here's the big complaint I get. They come in, they're like, man, I'm having to put a tube of glue in this stuff every week. And then they swallow this stuff. It's just nasty. And so who wants that? And if we can put some implants in there and attach their teeth, then they don't have no more glue, no more slipping and sliding, no more sore spots. You don't have to worry about relines, all that stuff you have to do. It's a one answer for the solution that you're always looking for, or they're looking for. Sometimes they're not sure what they're looking for. But once they get the implants to hold the teeth in, then they start to discover things that they had forgotten.
Now, is it true? You told me this on the telephone. The people in your practice can, on the day of the procedure, can walk in with no teeth and walk out with a full arch of teeth that don't come in and out.
You're exactly right. And we do it all the time.
So that's not an exaggeration.
No. They always leave with teeth. It depends on what procedure they get. Some are in and they don't come in and out. Some come in and out. It depends on which one they get. But They always leave with teeth. So they come in, they have the procedure, all the surgery, and they leave with teeth that day.
Now,
there's never a time that they go without teeth.
Now, we're talking about dental implants. You teach other dentists from all over the country on how to do these procedures we're talking about today?
I do.
Is that right?
Yeah, a lot of them. Actually, I'm part of this group. It's an international group of people, and it's wonderful. So we're teaching new dentists that have never placed or placed very few implants, how to really place implants, because dental implants is a thing. I mean, to help people.
It's like hot right now.
It's hot. Well, it's hot now, and it's going to be as long as you can imagine, because nobody wants to go without teeth. And the old days of repairing and re-repairing and fixing and doing this, and just to watch
to a denture you're
until you
talking
get to a denture. Yeah, you lose this tooth, lose that tooth. Why not, if your teeth are bad enough, just get them over with and go right into get you some good teeth that aren't gonna. The nice thing about implants is they won't have a cavity, they won't have an abscess. You brush them and clean them like real teeth, and
they look real.
They look real, and you don't even know they're there. I mean, my patients that wear them, they know they're implant teeth, but nobody else knows. That most times they look, well, I'll say all the time, they look way better than everything they'd ever had. It takes them back in time. It's like the fountain of youth, so in a way.
Okay.
Yeah.
Are there a lot of people, by the way, where you are, that are wearing dentures or headed for dentures?
Randy, if I could tell you this, there are so many people headed to dentures or that have dentures. I mean, I don't know if you know Dallas Cowboys. Some people like them, some people don't, but they call it Jerry's World. It's a Cowboy Stadium, AT&T Stadium. It's a big place. Have you ever been there?
No.
It's huge. It holds 100,000 people. Let me tell you what. I live in a little town that's surrounded by hundreds of thousands of people. You could fill half that place with all the people, or maybe fill the whole place with the people that are heading towards dentures or have dentures already.
So in your area, if there's so many people that are wearing an upper or lower denture or headed to dentures, why aren't they all coming in to do this then? If it's so good, if dental implants are so good.
Well, the thing is they just haven't been informed. And if they have dentures already, they don't go to the dentist because they think they're done.
Okay.
And if they have the partial plate or the plate or whatever they call them, or the artificial teeth, they've just learned to adapt, and they just don't know that they don't know what there is available. The second reason that they don't do it is they think they're too old. I hear that all the time.
How old can you be?
Well, Randy, you can't be too old to do this. My oldest patient's 95. I was in a meeting. No, I was in a meeting and talking to a good friend of mine that does the same thing. He had a patient who was over 100 years old.
Now, why would somebody in their 90s want to get dental implants?
Why wouldn't they? I mean, just think about it. Chewing, eating food, tasting food, quality of life. I mean, golly, a long time ago, people died at 50, but people are living longer and longer. And when you get older and older and older, some of the best qualities in life are enjoying food or with your family. And, if you're at a retirement home or wherever you might be, and they bring you something and you can't eat or you can't, I couldn't imagine not having teeth no matter how old I was.
So statistically, they're not more likely to fall out or something if you're 90 years old?
Oh, no. I mean, golly, a 90-year-old is... My 90-year-old, 95-year-old patient, he might even be healthier than me. But it's not a matter of that. I mean, once you
put
the
bone grabs onto the...
Yeah, it works. It doesn't matter. I mean, there's very few reasons that the implants won't work, and age isn't one of them. Matter of fact, a lot of people think that as they get older, especially the older generation, that they're just going to lose their teeth. It's
You
infinite.
say patients tell you that?
Yeah, and I say, well, why is that? I mean, they might have all good teeth, but they just think they're going to lose them. I said, well, as you get older, do you lose your fingers and toes? I mean, stuff just doesn't start falling off, and nor your teeth. But should you lose your teeth, or if you have the dentures or partial dentures, then we can replace them with dental implants very successfully. And the nice thing is, a lot of people say, well, I'm so old, I'm not sure I can go through the procedure. They think it's this big medical thing that's going to stress their body, and they don't realize how easy the dental implants are today. It's very minimally invasive, easy, simple.
How soon can they start eating? So it's all done. They walked in with no teeth. They're leaving with a full arch of teeth.
Yeah.
How soon can they eat
Well,
something?
they can start eating the next day in a minor way. I mean, soft things, but it's right away. As soon as they wake up next day, they can start going.
But isn't it true, though, if you've been in dentures for 30 years, you're too old for the procedure?
Absolutely not. I mean, I hear that all the time. It's insane. You're never too old. The bone's still there. I mean,
But you do lose bone, though.
You do lose bone. Now,
dentures.
that's one nice thing that people need to know. Once the teeth are out, you lose bone indefinitely until, there's not a lot there. I hear that from patients all the time. They don't have enough bone. They've been told they don't have enough bone.
By other doctors?
By other
dentists?
doctors, specialists, whatever. I had a patient just the other day. She came in, so she had minimal bone, and we're going to get her full arch teeth, and there's plenty there to work with.
So what are you doing that's different than these other guys if they're saying, no, it can't be done, and you're saying it can be done?
Well, here's what it is. They used to think that they had to use the biggest, fattest, longest implant there was. Well, nowadays we have short ones, skinny ones, all different sizes, so we can pick the bone size. Most guys don't have the imaging I have. I have a machine that can give me three-dimensional sizing of the bone, so I can find exactly where the bone is and what kind of implant's going to go there. And so that eliminates a lot of the guesswork. As a matter of fact, all the guesswork.
Now, when people come in, how soon from the time they arrive can you tell them, I think we could do this?
15 minutes.
Are they ever skeptical?
They're very skeptical.
Do they say, are you sure?
They're saying, are you sure? Because I've already been told I couldn't. And I said, but you can. And they're like, okay.
But what about their gums? Like if they have loose teeth and bad gums, can they still do this?
Randy, that's the best patient ever. Because once the teeth are out, the gums heal up. We put the implants in, it all goes away. And then we
What goes away?
The gum infection. Everything about, their mouth is like spick and span brand new. And then we have a nice platform to work with and give them new teeth.
Do they tell you chewing stories? Like do they ever say, hey, doc, I just had this or that?
I've heard all sorts of stories. More than you want to know about. There's a million of them. Even in the last 2 years, I put in, I'm not trying to boast, but I put in well over 2,000 implants the last 2 years. And I hear stories that just make you cry almost. But they can't chew, they can't taste. They have a foul breath, or they have they have bad taste in their mouth all the time, and there's just 1,000 different things. And so traditionally, we'd go in and do a bunch of crazy stuff, which made no sense. It just prolonged the process of losing.
Patchwork. I mean, you kind of patch things up.
It prolonged them losing their teeth. But now, why wouldn't you just? It's kind of like playing, what is it, Monopoly? You can skip here and go straight to go or what? I don't remember that guy. I used to play a lot. But you can skip all that stuff and just get done with your teeth and get something that works. Something you don't have to worry about anymore. One-time deal. And the nice thing about implants is it's pretty much a lifetime fix. I mean, golly.
So it's just a permanent set of teeth.
Yeah, forever.
Now, I know you brought photos. And so we'll have time to get through a few of these. What are we looking at?
Well, we're looking at a bunch of different people. We have old and young alike, men and women. And this first one, this couple, they just met, got married, and this is one of my stories.
Let me take a look. That's that guy?
He's 88. 88.
All right.
And here you go, take a look. He and his wife both came in, and they wanted to get their implants and their smiles made over because they wanted to start a new life together. And she's younger than he, but man, they are so happy, and I've got them all fixed up. And you know what he told me? This 88-year-old guy. He said, man, I feel like I'm 25 again. And he just laughs and laughs. Like he's loving it. And, he's an ex-Marine or whatever he did, and he decided he wanted to be different. This guy, man, he can eat his steak, he can enjoy vegetables, and he can eat nuts and do all the things he likes.
Can you bite like an apple with your front teeth or a carrot? Once they're all healed up?
Yeah, you can. You can. You can eat a lot of different things you want. One of the things that people lose, or I don't know about you, but where I live, it's like I like peanuts and I like raw vegetables, and most people do. Or Texas and Oklahoma, barbecue, eating baby back ribs and stuff like that. So these people want that. And what happens over time, they realize that they are not able to do that. Their teeth are too broken down or whatever. They're basically swallowing their food, not chewing it, and they're not enjoying it. And especially as you get older, then you need that nutrition, the fiber, and all the things that come with it. Let me show you this next patient. I mean, he was just in misery. He wasn't enjoying life at all. So with this guy, what we did, he came in, he knew he didn't want dentures. He wanted a solution. I mean, everything was going bad all at once, and he knew he had to do something. So what we did for him is we put 4 implants on the bottom, we put 6 implants on the top, and we gave him new teeth that he could really function with.
So a full arch of teeth?
Yeah, full arch of teeth, top and bottom. Yeah.
Wow.
And I mean, look, he's seemingly happy in the first picture, but look at the second picture. I mean,
he's almost laughing, it looks like.
I know. He's like, how happy can I be? I'm so glad I did. Matter of fact, one of the things I noticed, all the many hundreds I've done, no one is, after the fact, has ever told me they wish they had never done it. It's like, boy, I wish I'd done it sooner. I wish I'd done it 100 years ago. I wish I hadn't listened to those other people. I wish I'd have found you. I mean, I have people that's like, oh, you're my savior. You fixed me. You made my life different.
Because you play on Sundays. Our show airs on Sundays.
It does.
And you
One
told
of
me
the
in the
ones,
green room, and the patients will say, I think it was God that made me see and learn about dental implants.
And I don't doubt that. It was that moment. What happens, these people are in their house watching the program, and they know that something has to change. And they come to a reality with themselves, and then they see the program and they get informed. That's the biggest thing people tell me. I'm so glad you did this program because I found out things I never knew before. I never knew it was possible. And then that draws them to come to see us, and we're able to help them transition their lives. And that's what I love to do, transition people's lives. I mean, some of the stories, if I could just tell you one story.
Okay.
I have 2. I have a lady comes in just a few months ago. She comes in, we do a little interview. We want to find out what they want, and what they don't like about what they don't like about, and this and that. And she told me she has been, her husband died a number of years ago. She hasn't been out of her house in 5 years.
Because of her teeth?
She goes to the store and back in.
Like no teeth? She has no teeth?
She has messed up teeth.
Okay.
Yeah, and she's embarrassed. And her biggest desire is to be able to go to church again and hang out with her lady friends and go out to dinner with her friends, do all this stuff. She's been a recluse for 5 years. So with this lady, we gave her a full arch of teeth, top and bottom, that snap in and snap out. It changed her life. She comes back a few months later. She's so happy. She's back in the church. She's doing charity work. She's with all her girlfriends and lady friends, and she's just a whole new person. What happens when we do this for people? It causes a change in them. it transitions them. People don't realize, and it's not fair, that your smile plays that big a part in your life, but it is. And if you're not happy with something in your body that's not working, and oftentimes it's your smile, your teeth, whatever the case, but once you get it fixed, there's other things that happen. It causes you to be more outgoing. Yeah, it can cause you to get out of your house in 5 years, be back in the community, do charity work, girlfriend, boyfriend, start dating again, job promotion, a raise. Some people are so embarrassed, their smile keeps them from even asking for a raise or even looking for a better job than they had.
You made a good point. You said 2 people on a job interview. You tell the story better than I do.
Well, I mean, if 2 people came in, let me show you this picture.
Okay.
Let's take a look. This is the same lady. On the before picture, same lady, people that have teeth that are kind of bad like that, they generally don't smile. Matter of fact, that's an interesting thing. They're all walking out there in the public, but you never know because they don't smile.
They look mad or
they're depressed, whatever the case. But then when you see the result after the fact, then you can see the difference. Now, and matter of fact, here's what's interesting. People that come in the office, for instance, like this young lady, or many of these people, it's real hard to get them to smile because they don't remember how to smile. I mean, really. I mean, we have to. I said, if you don't smile, we're gonna have to send my assistant over to tickle you because I'm trying to get them to smile, but they just have forgotten how to smile. I mean, it's interesting. It's a deteriorating progress that happens that they adapt to, and they don't realize it. But one day they realize, hey, something's not right here, and I've got to do something about it. And unfortunately, they don't know better. They don't know what's out there. So if they see the program, oftentimes I'm going to help them with that. And one afternoon, she walked in like this, and she left like that. And the rest is history. And she's a happy, happy lady.
And it looks like real teeth.
They look like real teeth.
That's a beautiful smile.
Yeah. I mean, one of the things that happens in the transition, people have become accustomed to what they look like. When they get their new teeth, they're not sure what to do with them. They're like, oh my goodness, this is crazy. I mean, and they have to get used to them, that this new person that they become. And sometimes it takes them back in time, like I said before, it's a fountain of youth, and sometimes they never did look that good. And it's everything. I mean, this door's open, it's a window to the future. When they get their smile done and they feel better, they can chew and eat and do all the things they want to do, and they can speak better, and they don't have to worry about, I have this one story about a boy, a younger, we have younger people now that are needing this, from a lot of sodas and different things, their teeth just deteriorate. And he stopped going out with his buddies because his teeth had become so bad he couldn't eat pizza.
Okay.
And so he just stopped going. And he came to the office, he saw the show, came in, he said, boy, what can you do to help me? I said, well, I know you're in your mid-30s, but your teeth are done. I mean, they're too bad to repair, it doesn't make sense. Let's get you out of those teeth, get you in some new teeth. We can do it in, but you'll come in one day, we'll do the surgery, we'll leave with new teeth, and the rest will be history. So we did that. And so when we finally finished the whole process, because we knew he just loved pizza, but he wouldn't go out and eat it, couldn't bite it, he couldn't eat it. So he came in, and we scheduled him on purpose around noontime, and we ordered a pizza, and we brought it into him, and boy, you should have seen the look on his face. He was so excited to bite this first piece of pizza with his new teeth that we gave him.
You say some of these people, like when they see their teeth for the first time, it's emotional.
It's emotional.
For them and for you.
Yeah, I mean, they cry, I cry. we all kind of hug, and I mean, I've been hugged and kissed, and it's like, oh my gosh.
So you don't get hugs when you do a root canal. You don't get hugs when you do these other things. Is that right?
No, but when this one right here.
Let's take a look. What is this?
Now this is. I want to warn everybody. This is real. This is my prize. This lady, we changed her life. She lived there in southern Oklahoma.
Let me take a look.
So this is before. When you see her after, you're not even gonna believe it's the same person. Matter of fact, I had to. We'll look at it a long time. She lived in right across the border from where I am. We're right by Oklahoma, and so she moved away. We fixed her. We gave her teeth in the day. Fixed her all up. Well, she moved away. We didn't know. We hadn't seen her in a long time. So she moves to New York. She found a boyfriend, moves to New York, and so I get this picture with a letter. Thank you so much for changing my life. And she autographed it and sent this picture. And so she's in New York City, New Year's Eve. And she sends this picture, and I about fell out of my chair.
Oh my goodness. Yeah, it doesn't look like the same person. That's the same person?
It's the same person. I called her. Like, are you sure? It was crazy. I mean, and so that really inspired me in what I do. If I can do that for somebody, that makes it worth going to work every day. What's funny is once they go through the process and the transition, a lot of times they don't realize the impact of what's fixing to happen to them. They get an inner confidence that they didn't know was there. They get that lion heart, if you want to say. They just go, one thing builds on the next. And they're not scared anymore. They can get out of their house. They can go meet people. They can be with people and eat, not worry about not chewing their food and this and that. And that gives them more confidence. And then they're able to move up in life, move to new places, change relationships, get new relationships, or a job promotion, all the different things.
Because of their self-confidence.
Yeah, it builds self-confidence.
Now, do most of these people come in, they just want a beautiful smile?
There's two things. Yes, that's one thing. The other ones, they want to be able to eat better. And here's two things that really happen that's crazy. People come in I just want my smile better. I want to look better. A lot of times women, they want, and it helps their facial structure and get rid of the wrinkles and a lot of the things we do. And in getting that, then they realize, because they've been debilitated for so long, their new smile, they suddenly realize they've forgotten they couldn't eat right. So now they say, oh boy, not only do I have a nice smile, but I can actually chew food. I can eat salads and nuts and crackers and
so
things.
They're happier about the eating part.
So they find a newfound thing out of what they came to get. I mean, they forgot they couldn't do all those things. They just wanted their smile. Now on the flip side of that, we'll have people come in, mostly guys. They just want to eat and taste food and all this stuff. And I'll tell you a story about this one guy. He's here again. We're right there at Oklahoma. So he comes in, he's got a big mustache and a beard and a cowboy for sure. And he said, I'm so tired of these dentures. I can't do that. And they're slipping and sliding and I can't eat right. I saw your program. Help me. I said, I can help you. So we gave him the implants. He got the snap in and snap out ones. And on his way he went, he is happy, happy, happy. So they have to come in for maintenance, okay? So he comes back. I'm like, who's the new patient? I hadn't seen him before. I didn't recognize this guy. He shaved his beard and his mustache. He realized that he had a smile that he had forgotten he ever had. And now he's out there, as they would say in Oklahoma, chasing women and having a good time, you know?
We have time for one more photo.
Okay. I have a bunch here. Can I maybe do two more?
A couple more. We got about 2 minutes.
Okay.
2 minutes.
Let me tell you about this one. This is cool. This couple's been married a long time. And they decided their teeth were a wreck, and they wanted to turn a new chapter in their life, in their marriage. And so they both came in and said, I want to be helped. I want new teeth. We want to look different. We want to move into our new life together, looking good and feeling good. They both came in as a couple, got their teeth out, got the snap in, snap out. They are so happy, and you can see the afters. Just look at them. Just look at that. They're headed off to renew their vows and all this stuff. Okay, here's
That's
a guy.
very nice.
Now this guy right here, man, he was looking for answers. He couldn't do anything. I mean, he just couldn't eat. I mean, his teeth were falling out and messed up, and he didn't want traditional dentures. You know, the people that come in. I mean, let me tell you something. Nobody wants dentures. They really don't. There's places that sell them. They get them. They get them because they think that's all there is. And they're miserable. Nobody likes them. I mean, nobody. I mean, they might tell you they do, and they put on a front.
But they can't really eat very well.
Oh, they're just mashed. I have people come in with no teeth and said, I can eat anything I want. I'm like, really? And I say, well, let me give you some implants. You know, I tell you what, I'll tell them, I'll give you some implants with some snap-in teeth, and if you don't like them, I'll give you your money back. Nobody's asked for their money back. They said, oh my gosh. You're a savior. You did it for me. I thought I could just eat what I could eat with no teeth or with dentures or whatever.
So this guy was headed for dentures.
Oh,
right?
yeah. And there was
So what'd you do for him?
So for him, he was headed for dentures. We took his teeth out, and we gave him full implants, a full arch, top and bottom. And I can't really remember. I think his are the ones that stay in all the time. They don't snap in and out. But we have both options.
A denture wearer or somebody that has to get their teeth removed, can either get a snap in, snap out, full arch of teeth, no more adhesive, right? They can still eat with those?
Oh, yeah. I mean, they're super stable.
Or you could get a full arch of teeth that are permanent, that don't come in and out.
Correct.
Well, that's what seems like everybody would want, right?
Yeah, well,
Teeth that don't come in and out?
Or you can even get individual implants to replace every tooth, but that's not necessary anymore. I mean...
So just 4 implants?
4 implants, bottom, 4 to 6 implants on the top, and you're good to go. It's as much like real teeth as you're ever going to get. Randy, one more photo.
Okay, one more.
You've got to see
30
this one.
seconds.
You've got to see this one. Look at that. So here's a guy again. His teeth had to go. There's no hope. So what are his options? He's going to get dentures that don't work or dental implant supported dentures. And so I gave him the options. Hey, I give everybody options. I'll make dentures if they want them, but why? So he went with the dental implant supported dentures, the ones that snap in and out. And look at his picture.
Looks good. Looks good. Time for that last one. I know you want to show these.
Okay, one last one. Same thing. Teeth had to go. I mean, to repair her teeth was impossible. And so what we did, it's either dentures or dental implant dentures. So, I mean, hands down, there's no chance that and when I give them the options and show them the different benefits, they never pick dentures, ever.
So they can eat, they can chew.
Yeah.
They're never without teeth. Now, insurance. Insurance in the U.S. doesn't really cover the whole procedure. Medicare, Medicaid does not cover this, but you have financing, things
we
like
do,
that.
and what I would do is I would just invite people to call and come in. We do free consultations all the time. If they'll just call the office, come in, and we can find out what their needs are and what we can do for them, and we can work out the financing part. That's the least of my concern. My goal is to make them different.
Now, we haven't mentioned, but for people that are just tuning in, I mean, you teach other dentists all over the country on how to do dental implants. Does it cost more to go to a guy like you?
Why should it? It shouldn't.
Okay.
I mean, actually, for the patient, it's better because they don't have to go to multiple locations to get the procedure completed. Everything's done there, and if anything, it's more cost effective. And now here's the good thing: I've done thousands of implants, at least 6,000 or better, 2,000 last year. So the nice thing is they're going to come to a person that knows exactly how to do it. And so there's no guesswork. We have everything there. I have a great team. Everybody takes care of you. We coach you. We take you through the transition.
But nobody likes going to the dentist, by the way. Do you hear that?
Oh yeah. It's terrible.
But then you also told me people like going to you.
They do like going to me because once they get there, they realize we're different.
Okay, good.
Yeah, we're able to.
So don't put it off. Somebody watching this, their teeth are falling out. They know they're probably going to end up in dentures, or they're already in dentures. Come in, free consultation.
Yeah, just give us a call. I mean, we're here to help you. I've been doing this for over 23 years. I've done dentistry all sorts of ways. At this point, I get a great benefit of helping people transition. I'm kind of like a life coach with their teeth. And I love to go to work every day and do this and get to see how they turn out and get to see their stories before and after and get to see their successes and everything that happens. That makes me tick. And that's what I'm all about.
Okay, good. I want to thank you for coming to the show. Great stuff.
Okay, all right,
And
good.
thanks for coming back.
Very
You've
good.
been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.